Exciting goes beyond medicine and technology at Children's Hospital Los Angeles. Dedicated dogs are inspiring smiles and reducing anxiety through their calming presence. Kate Burmaster is the director of the Armin Family Foundation Dog Therapy Program, and Sarah Rosten is a 21-year volunteer with the program. 21 years?
Yes.
Congratulations.
Thank you.
Well, thank you both so much for being here, and thank you for bringing Winnie and Scout. These are adorable dogs. Tell us how you can get involved in the program.
Yeah, so at CHLA, we use registered therapy dog teams to support our patients and families and staff across myriad reasons.
Sure.
So a prospective volunteer who has a great therapy dog can reach out to us through our website and find out the steps to how to be educated, evaluated, and trained to work with us. Really, if your dog loves people more than dogs, this could be a great fit for you.
Really? So, do they have to be this calm?
They don't have to be this calm. They have to have a good rapport with you and listen well. We do want them to have some basic obedience skills for safety, of course. But really, it's the innate temperament. It's a dog that loves connecting with all different people. Because when we bring a dog into a room, we want that family or that patient to feel like this dog chose to spend time with me and is enjoying it as much as I am.
Yes, that is so important. It's important in clinical care. So, Sarah, tell us how you got involved. You've been there now 21 years.
Yeah, I got involved. I initially saw a news segment about therapy dogs, which was a newer thing at the time, and I had a dog at the time I thought would be good for it, and eventually found my way to Children's and have been there ever since. And she is dog 4. And
dog number 4. And she has, I mean, she has such a sweet personality. You've been holding her this whole time. She's the most docile, sweet dog I think I've ever met.
She is.
And so this is what you're talking about, is the rapport with patients.
The rapport with patients, right? I mean, imagine you're a child and you don't fully understand what's going on and your parents are anxious and you're uncomfortable. And then something so normal and so
sweet,
so representative of the outside world comes in and just says, I want to make your experience a little more comfortable, a little more child-friendly, so that you feel better and you're better primed to recover.
Well, I have to imagine, I'm somebody, I hate needles. I get very anxious when a needle comes my way. I have to imagine for kids that happens a lot. But if I had a dog like Winnie at my feet or Scout at my hands, I would be fine. I'd be like, here, sign me up.
Yeah, I mean, and that's one of the ways that our program is really innovative, in that we try to find opportunities to specialize dogs so they can help with things like IV insertions, so that they can help with doing really complicated or uncomfortable physical therapy, occupational therapy, speech therapy, emergency department procedures. And so, yeah, your brain can't feel the comfort of a dog at the same time it's feeling the anxiety of the needle stick. And so if we can redirect focus to something this wonderful, we can really help.
Oh, yes, you guys are so sweet. Can you talk about the day-to-day operations, or what's it like for you when you come in with the dog?
Well, first of all, the dog shift is 2 hours there because they do get very tired. We come in and we find out which floor we're assigned to, and we go to the appropriate rooms that we're allowed to visit and spend anywhere from a few minutes up to much longer, depending on what the patient needs. Scout has been there while all sorts of things are going on, distracting the patient from whatever the procedure is.
Do the dogs get attached to the patients?
I think the dogs, I mean, the goal is for the dogs to truly enjoy their encounters.
Sure.
Sometimes they see the same patients over and over. Sometimes it's a new friend every time. I think the important thing for our patients is that we have over 125 different therapy dogs. And as you see, they run from big to medium to teeny tiny. And so the patients get excited about collecting the card from every new dog that they see and having that variety of support.
So they all get their own little card?
Oh, they all get their own little card.
Do people trade the cards? Or
yes,
people...
and display them and keep albums of them. So it's very sweet. And it takes this huge roster of teams for us to be able to do the work that we're doing over 125,000 interactions last year through the
Wow,
dogs.
that's so important. If people can't, maybe they don't have a dog and they can't
Sure.
get involved, is there other ways they can support the program?
Absolutely. We're 100% philanthropically supported, and so anyone who is inspired to give kids this opportunity can donate to the dog therapy program at CHLA directly, and that money helps us sustain the work that we're doing.
Well, thank you both so much for being here, and thank you for bringing in these sweet, sweet dogs. We really appreciate it, and good luck with the program.
Thank you so much.
I think I'll be calling you. I have a very sweet little dog that loves people.
Come on down.
Okay.
We love it.
All right. She'll earn her keep somehow.
That's right. That's right. They get paid in pets and
Pets
treats.
love.
Yeah.
Yes, I can imagine. Well, thank you both so much.